Hi there, so my name's Bernie, and you may have been told recently that you need to have an eye injection. I've had quite a few myself, and I tell you something, when I was told I needed an injection, I actually shook with fear because I'd never heard of having eye injections before. But I've had quite a few now, and so I thought it might be useful to make a video for patients to see what it's like to have an injection. So, on the day of your injection, do make sure you have washed your hair, because they won't want you to wash your hair for about a week after an injection. Just make sure that there's no, risk of infection, and also that you have no holidays booked where you would want to go swimming, because they don't want you swimming for a week after an injection either. And that's going forward. So how many of you've had, always make sure you wash your hair on the day and you don't have any swimming holidays booked. On the day of your injection, do make sure that either someone drives you there or you take public transport, because your eyes will be blurry because of the eye drops they put in your eyes, and also the injection will momentarily make your sight blurry. So make sure that you have arranged for either public transport or for someone to take you. So when you get to the hospital, you're going to the reception and give your name. And the first thing they'll want to do is check your vision. And that's really important, because that will really monitor how well your sight is doing over the coming few months. And it's a good way just to see how healthy your eyes are. And then when they've checked your vision, maybe in the same area, they will check your eye pressure. And checking your eye pressure is really important, just to make sure that that is stable and it's a good number basically. And then after that, they'll put an eye drop in your eyes. And even if you're only having one eye injected, they may put that in both eyes. They do where I go, so I have an eye drop in both eyes. It can really sting. If you blink a few times, it might help to lessen the pain or make it a lot less, last for a lot less. So yeah, you make sure that you blink your eyes if you can. It is really hard blinking, I know it is, but it will help. It will help. So once you've had your vision checked, you'll go to a scanning room, and this is where they will be taking pictures of the back of your eye. And one of the pictures is called an OCT, and it's really good at just focusing on the health of the back of your eyes. It's a bit like having an X-ray done of your eyes, and it's very, very detailed, and it will show exactly what's going on. So once those scans are done, you'll go and sit outside just to wait and see the doctor. Now the doctor will have the scans in their office area where you'll go in. So once you're called in, he or she will have already seen those, and he or she will discuss them with you. And they may also want to have a look at your eyes as well. So you'll put your chin on a rest, and it'll be a slit called a slit lamp. And the slit lamp is what they'll use. And they may use a round sort of magnifying glass. It's like this sort of thing, and it's called a Volk. And they'll use that to have a look at the back of your eye for you. And you'll see a very thin slit, like a slit, actually that's why it's called slit lamp, but light. And after they've checked that, then they'll tell you that you need to have your eye injection. And they may well put a dot on your forehead as to which eye you're having injected, because you definitely don't want to be having the wrong eye injected. So do that, and then you'll go and sit outside the injection room. And it's really, as I said, it's really natural to feel nervous. I definitely did for my first injection, but I'm an injection buddy, and I do talk to quite a few people who have had injections, and I speak to them beforehand, and they do sound nervous, as anyone would be, but they do let me know afterwards it actually wasn't nearly as bad as I thought it was going to be. It sounds awful, but actually, yeah, it's over and done with really quickly. So once you're called in, you'll put your bags in the room. It's a clean room, okay? So in that sense, we don't want any infections, eye infections. So the people may well be all gowned up as if you're having an operation. So they have the headgear and the aprons on and the masks on and all that. But that is really just to keep it very, very clean in there. And they may ask your details, your name and your date of birth, and you'll be instructed to sit on or lie on a bed, sort of a bit like a dentist chair, I suppose, in a way, or yeah, a bit like that anyway. So you'll lie down on that, and the first thing they'll want to do is to put some anaesthetic in your eye that you're having injected, and some iodine. And the anaesthetic is obviously so less painful, and the iodine is really to clean the area, the surface of the eye. Okay, and after that they'll want to wipe the outside of your eye. So you'll close your eyes and they'll wipe it with for me they use a cotton wool bud on a prong thing. It actually, I have to say, this is the best bit. Okay, it feels like you're in a spa really, because they're wiping away your eye, and then they take it off with a nice clean dry cloth, and it's actually quite nice, especially if they've got a bit of music going on in the background, very soothing. And then after that they'll put a drape on your eye, and this is a sticky, sort of a big sticky square thing that it's made of paper, and it has a slit in it. And what that means is that so they'll pull the slit away, and then they'll ask you to open your eyes, and that just makes sure your whole face is is kept clean and away from anything that that shouldn't be touched. And then they'll use what they call a clip. Now the clip is really, really important, because that keeps your eye open, so you have no worries about closing your eye, and you'll be asked to look down and then up again, and then they'll insert that. It's not really uncomfortable at all. You've already got anaesthetic drops in there, so it's not even, there's no pain then. It's not really, it's fine. It's not an issue. And then they'll most probably put more anaesthetic drops in and more iodine drops in. Once that's done, basically you're ready for your injection, and the only thing you need to do is to look in the place they've asked you to look, because when they inject, they're injecting in the white bit of your eye. So basically they want you to look up and to the left or to the right or whatever. They'll tell you exactly where they want you to look, and they'll even maybe use their finger and say, follow my finger, and they'll say stop, and then that's where they want you to look, and just stay there. Okay, don't look away, just literally look there. Okay, and the next thing they want to do is maybe put some like a spot of anaesthetic on, maybe on a cotton wool pad or something. And just dab it on where they're going to do the injection. Sometimes they do that. So it all depends really on how they choose to do it. This is what happens with me. And then it's time for the injection, and the injection is really quick. I would say 2 seconds. Okay, that's how quick it is. Now, I'm just going to say that when the injection happens, you will see bubbles go into your eye. It's just the fluid, it's just the anti-VEGF drug going in, okay? And it's absolutely nothing to worry about. I wasn't told about that, and I started to cry actually, because I thought it had gone wrong. But you will see the bubbles, and that's absolutely as it should be, okay? It's very quick, and it's 2 seconds, and they'll take the needle out, and then your injection is done. Okay, that is it. That is the injection. That's the main bit over and done with. Okay, and then they'll just maybe put some antibiotics into your eye, just because obviously to help against any infection. And then after that they'll take the clip out. So look up and down again and take the clip out, and then they'll take the drape off, and they might just give a bit of a clean of your face, especially the dot and that sort of thing. They'll want to remove that. And then basically you're done, really. I mean, that's it. They may ask you, put their fingers, 4 fingers up. How many fingers am I holding? Just to check your vision is fine. This is a very just quick safety check. I make sure that's absolutely fine. And then that is it, really. And then you'll be able to sit up. And that, as I say, that is really is it. Basically, you'll basically be free to go after that. Your eyesight will be blurry for a little while afterwards, okay? It's absolutely natural, okay? Because you've got the drops in, the dilating drops, but also you've got, when you have an injection also, your eye pressure can go up a little bit. I mean, it's natural, your eye pressure is going to go up a little bit, okay? And that can also make things maybe a bit blurry. So don't worry, it will be blurry for a little while, but it will dissipate, okay? It won't be too long. There shouldn't be a lot of pain at all. You might feel a little bit gritty as the anaesthetic sort of wears off. It might feel a little bit gritty, but actually that's not, to be unexpected. That should be fine. But I would say by the next day, you should be back to normal, to be honest with you. Even I have my injections mostly in the afternoon because I want to do other things in the morning. And by the evening, I would say it all's fine. And my sight's gone back to normal and there's no pain. So some things they would not want you to do after you've had an injection, okay? Don't touch your eye, okay, that's been injected. Obviously, they want to keep it as clean as possible. They would like also, if you can avoid actually washing your face, with lots of water, please. If you can dab your face with a flannel, that would be fine, but keep away from your eye that was injected. As I say, you want to keep this area as clean as possible. So please, no swimming for a week, okay, afterwards. They'll also say that. Things to look out for afterwards, if you as I say, by the next day, really, you should be feeling fine. One thing you might have once you've sat up from your injection is you might get like a black dot, like an ink dot that appear in your vision, okay? That doesn't last long. That is just air bubbles, okay? It really reminds me of, I don't know, of course your ages, but when I was at school, we used to use ink pens with the quick ink, and it looks like a blot of that ink, if you know what I mean, and it can move around your eye. But that is just the air, and that will go. So that should have gone by the next morning, for example, or a few hours later. But it's absolutely nothing to worry about. That is just very, very temporary. Okay. But if you wake up the next day with a lot of pain, your sight is still blurry, and it's just not as you were hoping it would be, do phone up, just to be safe. Just better safe than sorry. Just to talk it through and say, look, I'm still feeling a lot of pain. Grittiness, I think, can still be expected. Don't touch your eye, okay? It will settle down. But if that grittiness goes on for a while, then do get some advice. So I really hope that helps. Please comment below if you'd like to ask any more questions. I'm really happy for to answer any questions if you have any. I've had over 100 injections in my right eye, and my left eye was 33 injections. I have diabetic macular edema, and I've had 3 different types of anti-VEGF now. I may have had less injections if I'd started more recently because of the drugs, but but I'm as I say, it's no issue to me at all. So, as I say, I hope that helps. And that's it. Thank you very much for watching, and I hope that's been really useful. And take care. Bye.